All right, perfect. Now it's a party. All right. Welcome, everyone. Thank you guys for joining us. We got Dr. John Young and Alex De Oliveira to do a little conversation between all of us. So basically how this works is we had people submit questions. There was no subject. It was no holds bar. So whatever anyone want to talk about, they could submit. I have the questions here. When we finish the questions, I'll open up the chat, and any questions that you guys might have, you just type in the chat and send it to me. You could do it in the general chat, or you could do it privately if you don't want anyone to know, you're asking the question. I'm going to go ahead and start. And basically the first question is for you, Dr. Young.
Oh dear.
My husband has Parkinson's for 5 years. Is there anything not too complicated that could be done to improve and or defer the progression of the disease? What would you do if you had Parkinson's?
All right, good question. So yes, there are some nice, cheap and easy things to do. Number one is most all the patients that I check have very low lithium levels. I'm not talking about the drug, but the mineral. You need the mineral lithium to make dopamine, which is the feel-good neurotransmitter that has to deal with Parkinson's. So the thing is, I'll get a level, most all of them are low, and I'll start them off. There's a way to titrate lithium, the mineral, to a dose where, that's adequate for them. They feel good with it. So lithium, number one. Number two, I want to make sure the vitamin D levels are over about 70, because vitamin D has a correlation to Parkinson's. And then third thing is, I will check and make sure that the sodiums, the potassiums, and the chlorides are up at the upper end of that range in sodium, potassium, chloride. The range, like for sodium, is 135 to 145. I like it for my Parkinson's to be up a little bit higher, because you just get better electrical control because you have enough of the electrolytes to make the electrical circuitry, which is part of the problem in Parkinson's. So there's a couple quick, easy little things. The last thing I've also done is use almost homeopathic progesterone under the tongue. And for about half of Parkinson's patients, it makes a huge difference in their symptoms. So it's low dose progesterone under the tongue, and it's made, for some people, they can completely walk again. So those are my little quick and easy things for Parkinson's. Alex,
Perfect.
you say anything?
No, I like the lithium. I like the lithium a lot, because also I think the second function of lithium is an antioxidant for your brain. So I think that's great. Yeah, I agree with everything. Yeah.
All right, the next question. Dr. Young, I'm in my 10th day now taking Arimidex. I was diagnosed with IDC breast cancer, stage 1, HER2 negative, but estrogen receptor positive. Did my lumpectomy surgery, chemo, and radiation. Arimidex has bad side effects, tamoxifen being worst cause of blood clots, but doctor says I need to take it. So my question is, can you suggest a more natural estrogen blocker? I take Fruit of the Spirit faithfully 2 times a day. Stop the protein because it gives me diarrhea. What are your suggestions?
Well, I mean, you could try another type of protein if it gives you diarrhea. Sometimes pea protein gives people diarrhea. Tell them to try, maybe a beef protein or a whey protein or whatever. All right, so, all right, I'll just let it rip here. One of the things that I've learned over the years, and it's from that book called Malignant Medical Myths by Kaufman. And here's what it says. You market a drug on relative risk reduction. You take a drug on absolute risk reduction. So the relative risk reduction for tamoxifen, these estrogen blockers, is about a 50% reduction in reoccurrence of breast cancer. The absolute for tamoxifen is 1.9%. So it helps less than 2% of the people that take it when it comes to reoccurrence of breast cancer. So I am not a fan of the drug because I think this is evidence-based medicine and the evidence is not there. The other thing is, you know, they did a study recently. You're supposed to be on it for 5 years. Very few people can stay on the estrogen blockers for more than about a year or so. So the compliance with it is a very poor compliant drug. Alex, do you have any ideas, I know, on more natural estrogen blockers?
Yeah, I agree with you. You know, when I have this conversation, it's very important to know what you just said, that, you know, the absolute risk reduction and the relative risk reduction, because the absolute risk reduction make it sound better than it really is, and it's really not. So that's number one. But the natural alternative, which I have used with patients that have been diagnosed with breast cancer and they need to keep their estrogen levels down, what I do use is DIM, D-I-M, which is a broccoli, basically comes from broccoli. It's a supplement. You just have to know how to dose that correctly. So I usually test their levels. I test 2 different types of estrogens, just because there's a bad estrogen, a good estrogen. So you want the bad guy to be low. And a lot of times those tests are not done. So I rather test both estrogens and give them DIM, basically broccoli, and keep an eye on that estrogen lower. I think it's a much safer way, and patients do really good.
Perfect. The next question we have, they put for Dr. Yun: what supplements and amounts should a patient with MS take daily? Any other advice for an MS patient?
All right, can I go back to the previous question real quick?
Mm-hmm.
All right.
About the estrogen hormone blocker?
Another anti-estrogen is iodine.
Oh, yeah. Oh,
Iodine is anti-estrogen.
yep.
So I would put them on 20, 25 milligrams of estrogen, of iodine.
Yeah, because you know what, I guess also, Dr. Young, what most people don't realize is that estrogen has several metabolites in, once it passes through the liver, there's certain metabolites that are not as cancer causing as other metabolites. And this is where the iodine comes in. So unless you do a urine test to see what are your metabolites, you don't know if you're truly lowering the right type of estrogen. So it's very possible that you can do the iodine, do the DIM, and you lower the bad estrogen, and you don't have a high risk of, you know, injuring those cells anymore. The other thing that's so important for the bad metabolites of estrogen, other than iodine, that I also like to use is magnesium, because magnesium helps to break down those bad guys, you know, it gets out of the body.
Okay. As far as the next question, it was more MS related. They were kind of curious as far as what supplements and amounts should a patient with MS take daily, and if you had any other suggestions for someone with MS.
There's been some interesting studies, and Alex and I were looking at them the other day with MS. One is that in this one study, they gave them vitamin D, and they ran those levels up around 250 to 300 nanograms per deciliter. So on when you get your vitamin D labs, it says normal is 30 to 100. Anything over 100 is toxic. Well, I have problems with that. And I've talked to Professor Hollick at Harvard, who's head of the Presidential Commission on Vitamin D. And he did this study and just showed with MS patients, when those levels were 250 to 300, they were very different patients, much, much improved. So, you know, I would definitely get it higher. The only thing is, if you're middle-aged and have MS, you just need to watch the calcium levels. So, your doctor can follow that. Other things that have been very interesting besides the high vitamin D is, and I've been doing this because there's some off-label use of Enbrel. Enbrel is a drug that they use for psoriatic arthritis. And you take it once a week for the rest of your life, and it helps control it. But the drug is also able to do something with MS, but you have to be able to know how to get it into the central nervous system, and you access the vertebral vascular system right at the back of the neck over about C7, under the skin, just under the skin. It's subcutaneous injection. And then you lay them down, face down for about 5 minutes because that system has no valves, and that drug will go right into the central nervous system. And it's been very interesting what it does to MS patients. I had one guy who, I didn't get him out of the wheelchair, but I got back the use of his arms for transferring and all that. The other thing has made a huge difference mentally, because a lot of these MS patients are very depressed, and Enbrel, an off-label use of Enbrel, is for depression. So I use that drug. It's an off-label use. And I like the high vitamin D. And then Alex, one of the articles talked about a higher dose melatonin in the MS patients.
Yeah, sure. So that's let's go, I'm just going to go back real quick to the vitamin D real quick, because that study that we were talking about the other day, it's so interesting. They kept those patients, those MS patients, on a high dose vitamin D for 5 years. And for 5 years, they did not see vitamin D toxicity. They did not see, like you said, if you're over 50 years old, don't do too much calcium, but they did not see toxicity, and they kept them for 5 years. Over 5 years, they improved their symptoms. So that's awesome. Melatonin, it's a hormone that after age of 35, you start to make less and less melatonin. I've heard from some patients, they were told that you have to be very careful with melatonin, don't take melatonin, this and that. I say if you are having issues with your brain, if you have multiple sclerosis, if you have a toxicity in the brain, if you have illness, something going on, you can actually use high doses melatonin. You can go all the way up to 50 milligrams of melatonin. So of course you have to start low, because that makes you very sleepy, and then you have to see if you can tolerate that much. But it's an antioxidant for the brain. If you go too high on the melatonin, there's some studies that if you take up to 100 milligrams of melatonin for certain conditions in women, can cause hair loss. So we try not to pass that point. But if you have MS, one of the things, because one of the interesting things about MS is then again is the mitochondrial function in the brain and the brain toxicity. And it's interesting because one of the ways that your brain knows how to detoxify itself is by sunlight. So the sunlight gets in your eyes in the morning and produces melatonin, and the melatonin is released at night as a hormone to get you to sleep, but also works as an antioxidant. So I think it's very useful, but you have to know how to do it.
Thank you. All right. The next question we have here, can anything be done for numb feet? I'm in my 70s, but not diabetic and have not had chemotherapy.
Dr. Young?
Well, basically, it's a neuropathy. In other words, a neuropathy means that the nerve is not transmitting properly. So if you want two things that are cheap and easy, and having done it a lot, I think that it's worth a try, is there was a study a number of years ago, alpha lipoic acid, ALA, 300 milligrams 3 times a day for 6 months, 80% of neuropathies went away. alpha-lipoic acid, 300 milligrams, 3 times a day for 6 months, and 80% of neuropathies went away. Then there was another study done with vitamin D. And I kind of, on my own, I kind of adjusted it. And you do have to follow calcium levels. But I gave them 50,000 units of vitamin D 5 times a week for 8 weeks, and about 80% of those people, their neuropathies went away. But if you're doing that, you probably want to check a few calcium levels and all that. So vitamin D and alpha-lipoic acid have worked well for me. I will just tell you this. You can do more expensive things. You can do Enbrel. You can do stem cells. But I would definitely start with cheap and easy, because there's an 80% chance it's going to work. Alex, you want to add?
Yeah, I think that all those things, I love alpha lipoic acid. I think it's great. I use it all the time with my diabetic patients. If it's non-diabetic neuropathy, B12 could be something also to look into it. And B1 deficiency, if you drink a lot of alcohol and you start having neuropathy, you might want to test your B1 blood levels. B1 is also kind of works like kind of B12. So it's good for your nerve system, for your mitochondria. If you've been on long-term antibiotics, some people have neuropathy from being on antibiotics, certain antibiotics for respiratory infections. So B1 can be helpful. I think so.
Perfect. All right, this next question, very specific. So Alex, this one's gonna be for you. Okay. A little bit of background. Female, 60 years old, on hormone pellets, only takes meds for low thyroid. She recently had blood work done to check hormone levels, and her glucose levels were high. She did her own A1C check. My A1C, this was her, was 5.8. Now what? What should I do immediately? Also noticed on my hormone blood work that my alkaline phosphatase is low, 37. What is that? Is that a concern?
Okay, so as far as the blood sugar levels, so if your glucose is anything higher than 99, 98, I would be having a conversation with you, because we need to address something. So we have to see, I act way before anything happens. So what I do and Dr. Young, what we both do, we order a fasting insulin, which is different than A1C. So your doctor will be ordering A1C, which is an average blood sugar of a period of 3 months. And I'm not doing that. What I do, I will be looking at your insulin hormone. It's a fasting insulin hormone. If your insulin levels are high, which does not correlate with A1C, that could mean inflammation, and then we need to address that. That can be a problem. The A1C at 5.8, it's not too high. That means you're probably your average fasting glucose is around maybe 98, 95. So I would have to look at the insulin level. As far as the alkaline phosphatase, interesting thing, it's not super low, so it's really not a concern. But I will say, if you are on a PPI, meaning one of those medications for acid reflux, Prilosec, one of those things, that can cause the alkaline phosphatase to be low. There's certain medications, certain steroid medications that can cause that, but also high testosterone levels can cause your low alkaline phosphatase. So if you did not have low alkaline phosphatase, and now you're doing the testosterone pellets and you do have low alkaline phosphatase, so then you might want to ask some questions about that.
Perfect. I'm pretty sure she appreciates that one. Dr. Yun, is there a solution for tinnitus?
Oh.
A tough one.
Yeah, take 2 aspirin and call me in the morning. Oh, wait, aspirin can cause tinnitus.
Yeah.
So there really is no, like strep throat, take penicillin, you're going to be okay.
Right.
So I think there's so many causes. I talked to, I forget, some big wig doctor up at Henry Ford Hospital in Detroit, supposed to be the big wig on tinnitus. And basically, drug-wise, he said, well, you can give them Antivert, you could give them Valium, and then after that, whatever you want to do. And I said, well, why do you say that? He said, because we really don't know that much about tinnitus. It hasn't worked well. So, I will do things like vitamin D levels, make sure they're adequate, because when the brain is irritated when vitamin D levels are low. So anything to reduce inflammation within the brain, I'm going to do it. Vitamin D, melatonin. I will also do, I like our cocktail, the Young Shake, but putting extra omega-3 oils in there, trying to reduce inflammation. I have had a number of people just swear that by going to see some naturopathic doctors and doing some homeopathic things has helped them greatly. And that's one of my best friends, has really done well just seeing some homeopathic doctors. And there's some ones that we refer to. You could ask us at some time. But there is no real, you do this and you're going to be fine.
Right.
Gotcha.
A very tough one. I will say for my ladies with the hormones, it's interesting you said that about inflammation of the brain. If the bad estrogen is too high, for some women, they can have tinnitus from that. So that does help when I start balancing their hormones because it's less inflammatory for the brain. And riboflavin, vitamin B2 can be helpful. It's hard to tell unless you try, because B2 is actually related to one of the genetic mutations that some people have very high dopamine in the brain because of that genetic mutation. And the B2 helps to move that enzyme. So riboflavin can be helpful, but then again, not always. And I like the fish oil too. I think that's very helpful.
Perfect. We're kind of at a halfway period. So what I'm going to say to everyone is it's an open forum. If you have any questions, we still have some more questions to go through, but feel free to go ahead and put those in the chat now. Once again, you could do that publicly or you could do it privately to me, so in case you want to stay anonymous. So any questions you have for Dr. Yun or for Alex, feel free to put that in the chat. Next question is actually for you, Alex. With secondary adrenal insufficiency, is it normal to have days where I feel really good and then be completely exhausted and feel awful all of a sudden, even though I'm taking my medication and supplements daily? Also, is there something I could easily do or eat or drink to give me an energy boost when I'm at work and start to feel so exhausted that I can't concentrate?
Yeah. So what happens there is adrenal insufficiency, in that case, secondary. So it was caused by, she wasn't born without adrenal or anything like that. It was caused by something. So even though you are taking your supplements, even though you are taking, your medication, what happens, remember, your adrenal glands respond to stress. So yes, if stress goes up or down, it might knock you out and you're going to be super tired or not feeling well. So that, yes, that can happen. It's a normal thing that happens. What I do advise my patients to avoid that, because really that's what you want to do. You want to avoid that scenario. You want to do salt. So the Himalayan salt is very helpful for that. You want to do electrolytes. I love electrolytes. I think it helps so many things, but your adrenals need salt. They need electrolytes. So I always say about 1/4 teaspoon of Himalayan salt in a bottle of water, or you can buy the electrolytes, but drink that water throughout the day, just slowly. Don't just drink all at once. That helps to keep up with your adrenals. Of course, hormones can help. A lot of women, I see a lot of women with adrenal insufficiency. So what I try to do, sometimes they're on prednisone, and I do also progesterone because your adrenals like progesterone. So that helps. DHEA hormone, it's a hormone that you can take it, so that also helps. But if it hits you and you just get super tired and you just think and you can't do anything about it, you might try some B12, a sublingual B12, just to get a boost and help you finish the day. But you really don't want to get to that position. You really want to avoid that.
Perfect. Can I add something?
Yep.
The other thing is vitamin C. The adrenals use a lot of vitamin C.
Oh, yeah.
So you may want to, if you can do an IV push of vitamin C, or, I try to take, 4 or 5 grams of vitamin C every day. So that's one way, because the adrenal glands use a lot of vitamin C.
And our bodies don't produce vitamin C. That's the thing here, right? So we really don't, we can't make it. That's sometimes I try to tell my patients, if you have adrenal insufficiency, what you really want to do, it's get an IV vitamin C at least once a month if that's possible, because that helps a lot.
Next question we have, Dr. Yan, I would like to understand, what does a PSA of 13 mean, and what are the various ways of getting a high PSA down?
Well, PSA of 13, normal is so-called 0 to 4. So that can be because of very severe prostate inflammation caused by bacteria, prostatitis. So that needs to be ruled out. That could be because of cancer. The other thing that can raise prostate, usually not PSA, usually not that high, is having sex a day or two before doing a PSA will raise the PSA some. So I tell them abstinence 3 days prior to your blood draw. But when it's that high, I think you need to really check that out to make sure you're not dealing with prostate cancer.
Okay. Varicose veins and circulation. Nobody talks about this, yet so many women are plagued by it. It was just kind of a general statement. Doesn't seem like a question. But do you have any input on that?
Well, Alex, you go first. You have no varicose veins.
I think my take on that, there's some genetic component to that. One thing that I think it helps a lot of people are flavonoids. So there are there's one supplement called Vascular that has some flavonoids in it. So it helps once you already have it, it helps with that. But it's inflammation. That's why you want to get ahead of any inflammatory process that you have at a young age, so you don't get to that point.
I have a little home remedy. Years ago when I was playing tennis, well, I still play tennis, but I missed a shot. Can you believe that? And, I didn't throw my racket on the ground, but I just kind of hit the racket against my right shin. And I developed varicose vein there. It was kind of like a thing of worms. And so what I did is I did pycnogenol. Pycnogenol is a very strong antioxidant. I did 500 milligrams a day for 8 weeks. It disappeared. And I've done that with a lot of women and guys. 500 milligrams of pycnogenol a day for about 8 weeks. Probably have to take a little bit of food, it can't upset your stomach, but it's worked very well in diminishing varicose veins. Strong antioxidant. So
personal testimony, we like that.
And I'll tell you, that stopped me from hitting myself with the racket. So
I'm sure.
My mistakes.
That's good.
All right, this next question is actually one that we get calls about all the time. Does Dr. Young recommend the regular flu shot? And if not, what are the reasons?
Oh, I'm losing contact. I can't quite hear you. I think I'm losing my, all right, listen, I will just tell you me. If you follow everything the CDC says, if you're born today and you live to like 80 or whatever, you're going to do about 137 vaccines. I mean, it's just ridiculous. So the other thing is this, at least our CDC is not that great, but last year, I think the flu shot was good for like 20% of the people, because they make that flu shot back in February for the upcoming year. I don't think it works that well. There are some interesting thoughts out there. I read an article that people that had the flu shot tend to be more likely to get a organism or a disease that causes a pandemic. I'm trying to be very politically correct here. So, if people get it, it's fine. I'm not, I don't do it. And, but it's a personal thing. There's no right or wrong here. I do keep my vitamin D levels high and watch what I eat, keep my sugars down, my vitamin C. But if you do get a flu shot, I will still talk to you and be nice to you. Alex, you want to put in your 2 cents?
Vitamin D, vitamin D, vitamin D. Did I say vitamin D?
Yes, you did.
Okay.
Very well done. Okay. I am receiving all the questions in the chat. We're almost there. The next one I have is, Dr. Yan, how would you treat a chronic Bartonella infection on a person who is allergic to all antibiotics that have been tried in the past?
All right, I'll give you, you can go on the internet. You can read other ways of treating Bartonella, herbal wise. One of the things that they're using herbally, but I will tell you, it's about 75% successful. It's not as good as so-called antibiotics or whatever. But biocidin is really just a mixture of herbs, biocidin. It's 10 drops a day for about 3 months. And that's been very interesting in studies on Bartonella. There's some other herbs out there, I can't remember all of them, that you can try. But probably the one that I think is the easiest to do is just biocidin. There's some things you could do, but they're very expensive. You're talking about spending thousands of dollars to do SOT therapy, to grow it out and develop a vaccine that only you could use. But I would say, if you're not going to do the drugs, which I think I wouldn't do it first, I would definitely do biocidin. Alex?
Yeah, I call biocidin, I call my natural antibiotic. That's what I call it, because for strep throat and so many things, it's so helpful. Such a good helpful thing.
That's our little trick of the trade. And if you do it, send us $20 in every time you do it. But take warm water and you're going to gargle with it. Warm water about that much. Put in a couple pinches of salt and about 5 drops of biocidin. Gargle for about 10 to 20 seconds, spit. Gargle about 3 or 4 times. 99 times out of 100, you're going to come back saying, John, it's gone. It just soothes a sore throat almost instantly.
It does.
And so someone said, yes, you're right. So and you can do it 20 or 30 times a day, but it also works very good on just killing the organism. But listen, a sore throat, it drives me crazy.
Yeah.
Biocidin, salt, and hot water is an unbelievable treatment. There you are.
Can high levels of vitamin D cause buildup of calcium in your arteries?
Hollick just did a big study on that, and they could find no proof. And these were people that are doing 200, their levels were up around 250, and there was no increase in kidney stones, calcium stones, things like that. So I think that's, Hollick told me, Professor Hollick, there's just a lot of bad studies, bad information out there. And so, no, I've never seen it. He hasn't either.
Alex, can you give the name of the bad estrogen again?
Estrone.
Thank you.
And a good one is the estradiol.
Bad estrone, good estradiol. Gotcha. Dr. Young, what's your recommendations for dealing with IBS during and after a flare-up, specifically foods to eat or avoid and supplements recommended? Probiotics aren't helping at this point.
So I read the question again.
So it's somebody that's dealing with IBS, and they want to know what your general recommendations are for during and after a flare-up, maybe like regarding nutrition, like foods to eat or avoid, maybe even supplements. They have tried probiotics, but the probiotics aren't helping them at this time.
All right. I think, I like to give them glutamine. Just as a great GI tranquilizer, you might say. Very healing to the gut. Number 2 is I will have them pick out 3 probiotics. And they take one for 1 week, a different one the next week, a different one the next week, and alternate that for about 3 or 4 months. Because you want to, when you have IBS, it tends to mess up your intestinal flora, and you don't want to put the same probiotic in there day after day after day. There's other organisms in your gut, about 800 organisms. So find 3 different probiotics that have different organisms in them and use that to populate your gut again. I tell them to watch, the sugars. Stay away from sugar because that's going to be a pro-inflammatory. Stay away from the corns, the rices, the white potatoes, the white breads, anything to lower the inflammatory index.
I agree.
Okay.
Alex, for thyroid, what does it mean if TSH is low, but T3 and T4 are in a good range?
Oh, I love that question. Love that question because it means different things for different people, okay? So as far as your doctor, the low TSH, just the low TSH will mean that you're hyper, you're producing too much thyroid. For me, the TSH is irrelevant. TSH, it's not an actual thyroid hormone, right, Dr. Young?
Yes.
It's just the thyroid stimulating hormone. So it tells the thyroid what to do, which means if your T4 and T3 are both fine, that means your thyroid function, or if you are on a medication, they're both working. There's another thing, which is the TSH, and that's another little trick. TSH responds to iodine. So sometimes if you take iodine, you correct the TSH levels. And if you need to show like a good blood work, just have a blood without messing up with you medication, you take enough iodine, those TSH levels will go back to normal. But this is a big issue. This is a big discussion because what's happening now, there was a paper that was published not long ago talking about the low T3 syndrome. They're finally waking up to the fact that people can have low TSH or normal TSH and have a very low T3. So you go back to your doctor and you say, well, my TSH is fine, but I feel awful. it's what we call the low T3 syndrome. That's their name. But basically what it is, the test, the TSH itself, has been used for many, many years as a standard, gold standard to assess the thyroid function. It's really not a good test. Basically, that's what it is. So you really have to look at your T3 and T4 levels to have a good reading.
Alex, you know, and following up on that is, you know, the people that have probably built our practice the fastest are the endocrinologists out there, because they are the experts in thyroid. And once my patients get so upset with a thyroid doctor who goes on TSH and they're like, you tell me I'm fine, I'm losing my hair, my eyebrows, my skin feels terrible, I'm gaining weight, I have no energy, I'm dying here, and you tell me to get used to it, or maybe I'm depressed, then they show up at our office. So thank you, endocrinologists out there. The other thing is this. It is not, most lab tests, they're not a yes and no. It's a range. For free T3, it's 2.3 to 4.2. You have to figure out where on that range do you fit best. And that's why Alex and I are always asking you guys, you know, how's the hair loss? How you're feeling? Because I have people that are just inside the range and they are just, they have more energy than Adam Ant. I have people I would get to the upper edge or even a little bit more before they can wake up and actually function. So learning, and you know, Alex and I see this all the time. When there's a range out there, you have to figure out where you fit on that bell curve. And that's why I think we've done very well with thyroid, because we realize that. Just because you're a point in doesn't mean it's right for you. And doctors, because of the way medicine is, it's, you know what, I got you for 5 minutes, lady. Here's, you know, got to fill out my computer stuff, electronic medical records. So they don't have any time to really sit and talk to the patient to find out what's going on. And, you know, once, I mean, Alex and I have gone over that over and over, and, you know, just this free tea, they've completely forgotten about.
Okay. All right, this is really for either or for both. Dr. Young mentioned a new study released revealing that high levels of testosterone are injurious to women, increasing risk of cancer, especially breast cancer. Can Dr. Young or Alex elaborate on the study and be specific about the study parameters? Also comment on ideal range of testosterone levels for women on bioidentical hormone replacement therapy.
Sure, Alex would be glad to talk on that.
All right, so I know this study they're referring to. I actually have it here on my desk. So the thing about that is, what people have to realize is hormones, they, in the body, let's say if I'm just giving you testosterone, I'm not giving you any other hormones, I'm just giving you testosterone, no estrogen, no progesterone. Your body will take that progesterone, that testosterone, and can make estrogen from it. So what the study was saying is that high levels of testosterone in women can activate the estrogen receptors that causes cancer. Now, I do know this, that like, then again, what I said before, there are different metabolites of estrogen. So your testosterone can be, let's say 500, which a normal range for women, I'd say up to 100, you know, you can, if you're doing hormone replacement and you're feeling good. Some women don't like to go that high because they have acne and hair loss. They like to keep it lower. So we can keep it around 45 or 50. But if you keep it super high, like 500, which I normally don't do, then you can have a lot of conversion towards estrone. And if you don't test, you don't know. But if you test and your testosterone is high, let's say super high, but you're not converting towards estrone, then you're probably going to be fine. But you see, that's what Dr. Young just mentioned. a lot of these studies, they have a lot of flaws. So they don't necessarily give me all the information that I need. They're not really looking at all metabolites. It could very well be that some of these women have genetic mutations on the testosterone estrogen pathway, and they just go towards estrone real fast. But they don't look at that. So all we know, as far as they publish, when you have high levels, very high levels of testosterone for women, it could be estrogen, it cause estrogen driven cancer. So that's just what they're saying. But I always test everybody's level just because.
Thank you. All right. So with the climate, with everything that's been going on, the best general question way to put this to you, Alex, what do you recommend for people to keep up with their immune system, or just to keep it up in general?
Okay, so that's a good question. Here we are, September 2020. So without saying too much, right? So really what you really want to do, you know, listen, it's all about your immune system. It's all about what's going on with you, right? So if you are, then again, if you have very low levels of vitamin D, if your vitamin D has ever been tested and it's below 20, you don't want to, you want to make sure you get those levels high, because any problems with your immune system, influenza or anything, you're going to get sick. So you got to get those levels up high. But when it comes to immune system, we also have to think about the things that we don't want to do. So we are in a pandemic right now. Everybody's super stressed out. So there's certain things that we want to do for relaxation. But one of the things that we should avoid, it's actually to do a lot of sugar, a lot of processed foods. We really don't want to do a lot of alcohol during this time, because it does lower your immune system. So anything that you can do to protect your immune system, and you really want to bump it up your vitamin C, right, Dr. Young?
Yes.
That's what I think.
And you want
What do you have a vitamin C you recommend, or are they all comparable?
What do you say? Which is the one you like, Dr. Young?
Oh, I like the powdered vitamin C.
Yeah.
Because I put a little bit of orange juice at night, and Karin and I take our iodine, our vitamin C, and our vitamin D. Because we take, about 6 to 7 grams, but that's our bowel tolerance. Because we go for loose but formed stools. So maybe we'll get a T-shirt like that, loose but formed. But that's where we go. I like it powdered because I wouldn't want to, I get tired of taking a bunch of pills. The other thing is, I would say, add to what you said, Alex, is this. Your immune system, the IgG, E, A, and M, they're all proteins. And people are saying, yes, I like the vitamin D and I like all of that, but you need protein to make your immune system also. Yeah. So people come to me and they're telling me, I'm eating organic lettuce and organic broccoli and organic whatever. And I'm saying, but you don't have that much protein. It's like trying to build a house with 2 2x4s. So, the rule of thumb is 1 gram of protein for every 2.2 pounds of body weight. I never go over 100 grams of protein a day. So you do need protein. And I will tell you this. All right, what day of the year are most students sick in the school system? It's November 1st. What happened on the day before November 1st? Halloween. Sugar loads, lower your body's immune system. And recently, the other day, and don't tell anybody this, but I was over at some people's house and we had some cake and ice cream. And then I had some Hawaiian punch. I'm getting counseling later. And I'll tell you, I could tell my immune system was not quite there. So, but you need protein with the other stuff.
Yep.
That went through the questions that were submitted previous. I've been kind of going in and out of the chat. So we're going to go into the chat and get some of those questions answered. Any questions that we can't get to, because we got about 10 more minutes, you can send to mariapfhc@gmail.com, and our providers will answer them. I'll give that email again once we finish, but we will make sure to get to those questions. Alex, what do you give for low T3?
Low T3, if you're already on T4, we can just do Cytomel, which is a T3 prescription, or we can do a low, sometimes I do this, sometimes I do a low dose natural thyroid that you can get at your pharmacy, like a 15 milligram dose, just to get you more T3 that way. But it depends on the patient, depends what's going on.
Okay. For either, what is an alternative to Symbicort for pulmonary nodules caused by sarcoidosis?
Dr. Young.
How did you know? Yeah, I like that question because I've done it enough. Intravenous vitamin C tends to reverse. Every patient I've had with that, nodules from sarcoidosis, IV vitamin C has taken them away. And I had it was a lady down in Bradenton, bad sarcoidosis, and you know, just didn't want to do what her pulmonologist said. So she came up here, and I gave her intravenous vitamin C for about once a week, sometimes twice a week, for about 3 months. And then went back and ordered x-rays, and she went back to her pulmonologist, and she handed him the x-ray, but put hers on top that I had ordered. And so he went through the x-rays, and he said, see, bad, 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 and look, this one completely clear because you did what I said. And she says, Dr. Young ordered that. I've been doing IVs with him, completely clear. And he just swallowed a couple times and said, well, way to go. So I like intravenous vitamin C for thyroid nodules.
You're causing trouble.
Sarcoidosis.
You're just causing trouble.
I know, that's why I'm careful when I go down to Manatee County.
Just a friendly reminder, this is recorded, and this will be up on our YouTube and our website. Moving on. I am entering menopause age. I notice that I'm getting mild hot flashes, lower energy, out of sorts feelings. What are my first steps to do the right things health-wise in this new phase?
Oh, that's a good question. I feel you. I do. I understand. So I feel like the first thing we should do before you even do hormone replacement, because it's unless you get tested, you really don't know. And this is a great question. I love this because I think most women need to understand that once you start entering menopause, it's going to be very, very rocky. It's going to go up and down, and you have very little control over your hormones. It's going to happen what's going to happen. Your ovaries are just going to go crazy, and you're not going to feel good, and eventually your period will go away, and it will come back, and it'll go away, and it's just like crazy like that. One thing that I feel like for my patients that they kind of go through menopause just fine, I find that there's two things that they do that really helps them. One is to have a very stable diet, very doesn't vary very much. It's a very low sugar diet, enough protein, balanced amount of carbohydrates, nothing too crazy. Usually those patients do really, really well through menopause. So diet-wise, it does affect your hormones because remember, as you entering menopause, your progesterone levels start to drop, and sugar makes that progesterone drop even faster. So less sugar and carbohydrates you eat, better and more stable you feel, even though things are still going to be rocky. So diet-wise, that needs to be like number one. Then again, very little alcohol because of the hormones. And also Go back to the hormone, vitamin D. Vitamin D is not a vitamin, it's a hormone. You have to have that optimal. If you have low vitamin D and low estrogen, low progesterone, your brain's not happy. It's going to be another, not good. So, but diet, that's a huge one. And exercise. So some people like to do, I always recommend during perimenopause, starting menopause, gentle exercise, not too much cardio, but a lot of yoga and weights. Because if you do too much cardio during that time, you can actually start gaining weight and holding on to fat. And that doesn't make you feel good either. So you have to modify certain types of exercise also.
All right, Dr. Young. All right, here we go. What's your thought on the cellular dysfunction brought on by taking statins? My research shows that the chance of having a heart attack without taking statins is 2% and only reduces to 1% when taking them. That hardly seems worth it. Back to your absolute risk reduction point earlier, I wonder if the trade-off is really worth it. Do I just add in CoQ10 to offset the damage done to the mitochondria? Or should I just go off the rifampicin altogether? And how do I best handle that conversation with the cardiologist who clearly thinks it's worth taking?
All right, so, everything in medicine is supposed to be this evidence-based medicine. And what I've told my patients is this: talk to your doctor and say, listen, I want to be aware of what I'm taking, and you've prescribed a statin drug. The absolute risk reduction for this drug is 1 or 2%. Now, some of the side effects of this drug are dementia, early dementia, muscle aches and pains. So the thing is, I would say to them, it really, the benefit, I think, is just so small, it's not worth it. There's a number of doctors that, they work for a big organization, so they're required to put you on that. Alex and I are not members of any big organization. The other thing is, if they're going to fire you and you still like your doctor, then I would take the prescription, I just wouldn't fill it. There was a very, Eads and Eads, husband and wife, Michael Eads and his wife, they're both doctors at University of Arkansas Medical School. And Eads is kind of a history buff. And a few years ago, a document came up that he bid on, and he won. It was an auction. He won the first copy of the Framingham study. Framingham's the town in Massachusetts that Harvard has kind of took over back in the early 40s. And they've been studying these people for years now, in tremendous studies. And one of the first things they looked at was heart disease. And in the original first edition study release, here's what it said. In the Framingham study, the people with the highest cholesterol had the lowest heart attack. The people with the lowest cholesterol had the most heart attacks. But Harvard, who also owns the Pritikin diet, rewrote that as the people with the highest cholesterol had the most heart attacks. There's study after study that has shown that there is very poor correlation between cholesterol and heart disease. There's more correlation between triglyceride levels and heart disease. I will just tell you this, having read a lot of the books, and I never thought I'd say this, but always in all of this stuff that you're doing, look at who's making the money. That's all I'm going to say.
Yeah.
Perfect. Well, first off, I want to thank our nurse practitioner, Alex De Oliveira, and Dr. Young for joining us. That's all the time we have for today. I believe we're probably going to do this maybe like once a month or so, do these Zoom conferences. If you have any additional questions, please send them to us. We will get them to answer them for you and get back to you. The email to send them to is Maria, P as in Paul, F as in Frank, H as in Henry, C as in Charles @gmail.com. So that's mariapfhc@gmail.com. Also, shameless plug, if you guys enjoy us, if you like the clinic, please give us a Google review. It means the world to us. We love you guys, and that would be a great way just to show some appreciation. And thank you for joining.
And if they want to give constructive criticism, we're also open for that, or how to make these Zooms better. Let us know.
Thank you, everyone.
Thank you, everyone.